I do have a few slides that I want to walk through before we really get into our discussion, and I'm doing this more for context setting. So just as a formal introduction, my name is Chris Boone. I'm the Executive Director for the Health Data Consortium. And the Health Data Consortium, for many of you who don't know, is a public-private partnership focused on fostering the availability and innovative use of open health data. We are, and as Davis mentioned yesterday, we're the guys who are actually responsible for Health Data Palooza, for those of you who may be more familiar with that. But we have a number of cute, cool things going on. So, but before, to provide you some insight into the structure of this particular conversation, I'm going to spend about 10 minutes just giving you a brief overview of what's happening in the landscape. We're going to delve into a deep discussion with our experts, and then we're going to open it up to you guys for kind of more of a town hall if you want to ask specific questions to our distinguished panel. Is that fair? All right. So where we are right now is that we are in a very interesting time when it comes to the use of health data as a broad concept. I think that generally all of us have kind of evolved into this quantifiable self, if we will, right? So we're looking at our smartphones always, looking at the number of steps you take or even the number of stairs you climb or whatnot. So we're seeing that citizens and patients or patients have become much more engaged in the use of data. So we're not just talking about government data sets, but we're talking about data itself more broadly as a concept. So what we're seeing right now is an opportunity to really take the open data movement that much further and that much closer to what we really want to do. But there are always challenges to moving it closer. I've highlighted a few challenges. This is not a comprehensive list, nor is it meant to be exhaustive, but it's more meant to be highlighting specific examples that we discuss all the time, such as standards or providing an economic justification as to why you should move forward with open health data, and also some of the cultural resistance issues that we all face, or that you all face in your particular agencies. But what I want you to understand is that I had the opportunity to talk to Carlos Ramos yesterday. I don't know if he's here or not, but we were talking about some of the trends and priorities that have been identified for many of the CIOs at the state level. So when you're actually making this pitch, it's important that you understand what's in front of them as well, right? So they're not looking at open data as not a priority, but more so as something that is just one of the priorities of a very long list of things they have to do. But as you can see, even at the city, county, and state levels, open data, open government continues to be one of their top 10 priorities. And that seems to move up the list every year. So that's something to keep in mind too. So the Center for Digital Government actually conducted a study last year where they highlighted specific open data sources or portals that exist. And in that, they basically scored each state. So as you can see where California is. They got a 4. I'll let you know. But some of the other states are a little bit further along when it comes to their adoption and embracing this whole notion of open data. First of all, you have Utah, Oklahoma, Texas, Illinois, New York, Connecticut, and Maryland as the kind of top contenders of organizations that have really moved forward with open data and their open data portal and making the data available and the quality of the data and the policies associated with it. So, but I knew that somebody in the audience would say, well, you said California got a 4. How is it that they got a 4? Well, I broke it out in the table so that you can see where the top scoring states, as well as where California sits and how the point allocation actually broke out. For a policy, you can only get a maximum score of 2 according to this report. California got a 1. Of course, when it comes to policy quality, they gave it a 0, for this is open data more broadly. The portal, they gave it a 2. Portal quality, they gave it a 1, for a total score of 4. Now, the key thing to understand is that each of the top scoring states either initiated their open data movement with an executive or pretty much a legislative mandate. And in some cases, they had both. New York is the only one that moved forward with only an executive mandate. Now, I highlighted Illinois mostly because we have Stephen in the audience, and I know he can provide some insider intel, especially on his transition out. So when you have some really specific questions about Illinois, you can talk to him. But I did want to highlight these guys for a number of reasons, mostly because Governor Quinn was very instrumental in pushing their open data movement forward, and they're also one of the top scorers, right? And so he actually set it out, and then he moved it forward by even launching a challenge that pretty much engaged all the municipalities in the state. So you launched it at a state level with data sets. It received pretty much, so it was pretty widely successful. And then he said, okay, well, we want to engage more of the municipalities. So then they launched an open data challenge at the city level, county level, right? Municipality level. And then they were able to actually include more data sets for this particular data portal. All right, so we're going to jump right into, and this is my contact information I'll leave up there, but we're going to jump right into the conversation with the audience now. Testing? Perfect. All right. Unlike some of the others, I'm actually going to introduce our panelists because they're such a distinguished group. I'm not going to read their entire bios because we'll be here all day, but I do want to highlight some specific things as it relates to this particular panel. First, to my immediate right, we have Dr. Jay Bhatt. He's the Chief Innovation Officer at the Chicago Department of Public Health and an internist at Erie Family Health. He is driving change using data, predictive analytics, and informatics to improve the health of Chicagoans. And you're going to hear from Dr. Bhatt here in a second. Next to Dr. Bhatt, we have Dr. Rebecca Coelius. She's a doctor using her background in clinical medicine, policymaking, and social entrepreneurship to advance the health of individuals and cities through the Code for America Health Focus Area. She also worked for the Health and Human Services Chief Technology Officer as the Medical Officer for Innovation. Last but most certainly not least, we have Cheryl Wold, right? All right, cool. Is passionate about using data and technology in innovative, collaborative ways to improve health and well-being. Her involvement in the open data space includes participating in Health Data Palooza, starting with formative work leading up to the inaugural 2010 forum to co-organizing the community track for the 2014 conference. All right, so before we really get started, I want you to hear from each one of our panelists. They'll describe to you exactly what they're doing, some of the innovative practices they've either led or seen more at the city, county, and state level. And they'll also share with you any pearls of wisdom they want to leave with you.
All right, well, thanks, Chris. My eyes will be squinting a little bit. I'm fighting the sun. We'll try to move over. There we go. All right. Well, it's great to be here. Thanks so much for the introduction, Chris. And you know, it's rare that you talk to three folks on the phone that you've never met before, and then you're on a panel with them, which is the case here with Chris, Cheryl, and Rebecca. So it's exciting to be with this group. And you know, we've in Chicago had the fortune of talking with the community at the California Department of Public Health as they've been traversing their journey of open data, and it's been humbling and inspiring to see the work that's coming out of that group and the state and the support for it. So let me just tell you a little bit about what we're doing in Chicago and anchor it around some lessons that we've learned. So in 2011, Mayor Rahm Emanuel launched Healthy Chicago, the city's first comprehensive agenda for public health. And it spans 12 priorities with 200 strategies and 16 areas, metrics that we're following as a result of those to see how the needle gets moved as a result of those strategies. One of those is public infrastructure. And so within that context is, you know, what are the foundations that help move health transformation in Chicago, and data is a critical element of it. So, you know, there's three, and Mayor Emanuel has been a strong supporter and proponent of open data through executive order actions, as well as supporting the Department of Innovation and Technology, and partnering with the civic tech community in the city and supporting that group. And so, one, there's the power of the idea, right? So we have a small idea, and that idea can be transformative, as you saw here in California. And that's sort of been a guiding principle of our work in innovation in Chicago. And connected to that is really this idea of the courage to disrupt and fail. Because if you don't have that opportunity to be supported through failure and learn from that to move forward, then that really halts sort of innovation in its tracks. And so we've been fortunate to have the support of the city and the engagement of the other city agencies around this. The other is the power of relationships and the opportunity to work with them And so, for example, Socrata and Esri and others who are in the audience have been incredible partners in our work, as well as academic institutions like the University of Chicago, or even private sector companies like Allstate. So we've been able to identify those partners that are willing to think about use cases and work together. And so some of those use cases are this. Foodborne Chicago, or Foodborne Shy, is a Twitter-based web application that takes tweets and uses natural language processing to identify those tweets that suggest foodborne illness, which then get routed to our, we send a tweet back to the resident saying, sorry, you might be sick, and it looks like foodborne illness should be thought about, and why don't you fill out this form and send it back to food protection. So that's what happens, and food protection evaluates and then sends an inspector out to the establishment, and then the result of that inspection gets put on the open data portal to close the loop. And this whole process has a service tracking number and so forth, so it's integrated within the 311 system of the city. The other is then taking that a step further, is using open data to predict those restaurants most likely to have a critical violation on their next inspection. And so we worked with Allstate and the Department of Innovation Technology to work through that problem, because it highlights something Abhi said yesterday, sort of thinking about the problem and then using the data to help solve that problem. So the problem was resource allocation and inspections, and the way that business was being done around food inspections was just inefficient and wasn't getting to people before outbreaks started happening. And so how do we use data and analytics to transform that process? And sort of we've taken that across the inspection spectrum. So we're predicting retailers most likely to have selling unstamped tobacco. We're predicting pregnant women and children most likely to be exposed to lead. We are working on a West Nile challenge with some partners about sort of around the same idea of inspections as a core public health function. How do we redesign it to using data to be more actionable and efficient and effective? And then the other part is how do we take that component and integrate it in the delivery environment? So with lead and that issue, we're providing it as a decision support tool in EMRs. So at the point of care, providers can use it as a way to either think about a lead test or use it as a way to engage people who've been lost to follow-up back into care. And the lead has a profound effect on children. IQ, mental health, capacity for learning. And so if we wait till the age of 5 before they enter school to have that test available for them and mandated, then you've already lost some time in their development. And then Healthy Chicago 2.0 is an interesting opportunity for us to leverage open data in an actionable way. And we are connecting our surveillance data with a Healthy Chicago telephone survey, which is the city's randomized sort of questions looking at 2,500 residents across the city, kind of like your BRFSS or Behavioral Risk Factor Surveillance Survey. It's 2014 data, and then that data, once we synthesize and go through it, we'll put it up on the open data portal so that the community in Chicago can actually use it, much like we use the BRFS data. And so, that's just some of the interesting things that are happening in Chicago, and we're learning a lot from others around the country.
Those are fantastic examples. Thank you so much for sharing. So I'm from Code for America. We're a nonprofit organization that was started in 2009 that believes that government can work, emphasis on can, by the people and for the people in the 21st century, if we all make it so. What that really concretely means to us is we partner with local governments around the country, usually city or county, but sometimes state, to partner together and use technology to redesign services to become digital services. And we also do a lot of work around participatory and open decision making, which leads us to do a lot of open data work. You could do a quick Google search and see our open data playbook and some of the descriptions of open data roadshows and such that we've done in the past, many of them supported by the California Healthcare Foundation, so thank you for that. So I'm going to go a little bit broader than Jay did and talk through 3 themes and things that we've learned looking across the country and through our work that sort of spans the country on open data. So first of all, whenever possible, the source of any data that you're putting into your open data portal or just releasing as a data set should be the same source that you're using for internal decision making and operations. Whenever possible, because of course there's lots of questions and concerns around data being private and that sort of thing. I think, Jay just spoke through a number of really specific examples where that's happening in Chicago that are fantastic. Another example that's more in the sort of housing, public health, urban redevelopment category is in New Orleans, where they take blight status data from their data portal and use it for their own internal operations as well, tracking blight and sort of doing different interventions around it. We've seen a couple of things come out of this. One, the quality of the data is much better. The quantity of the data is much larger. Suddenly, when you have people internally having to use the same data set, it becomes pretty clear what's missing and what's acceptable and not acceptable in terms of how often that data set is actually updated. And it also builds an immense amount of internal support for open data generally when people can truly see the value of that open data portal in their day-to-day work, which builds support for additional data sets to be made available on your portal. Two, something that I think has been a theme here today and yesterday. Data is not the same thing as useful information, much less a tool for most people in this country and the world. And coming from Code for America, it's, I think, an immense amount of work has been done and many successes have been had in engaging external communities and taking that data and transforming it into information and tools. But sometimes I think we forget that we have to also build our own internal muscle to taking that data and doing something meaningful with it. And so Code for America has a new talent initiative, which is supporting local governments and both retraining their own staff to become data analysts that do more than just write reports, but really take this data and turn it into useful information and tools for the public, but to also bring in people who previously wouldn't consider working for government to come in and solve some of the really important problems you can work with in that domain. Three, many of us, especially in this room, are now passing through what can be considered sort of the first phase in open data, where we looked across all of our many, many data sets and said, okay, where's the intersection of what's going to be useful, but also sort of politically and technically feasible to release relatively quickly? And we're now getting to a place where it's probably going to get kind of hard before it gets easy again, because we're approaching data that's more politically contentious, where the data itself is sort of ugly and there's a bunch of work that needs to be done to put it out there. And some of the data probably can't be released entirely openly, and it fits more into this my data bucket that the federal level talks about around people having access to their own, and health, their own medical records and other information personally about themselves. So as we move into that phase, we really advise that we start to pursue this more from the perspective of a human-centered problem. Pick human-centered problems that are very, very deep and very broadly experienced instead of starting from the data sets. Look for the nail, don't have a bunch of hammers, and it leads you down the path of figuring out what to prioritize and when. I think a really great concrete example of this actually happening out of CMS are questions around what data people need to make decisions around their insurance purchases. And I think Will Lightbourne is really right that there's much more to making decisions than just shopping. But unfortunately, insurance is not a thing that you can go personally visit and sort of see and make a decision about in that way. So we need much more information to make good choices around our insurance plans. And the things that people consistently say they need when making those decisions are, one, physician network information. So I can either know that the doctors and facilities that are going to be part of my plan are high quality, or if I'm already somebody who has multiple comorbid illnesses, I need to know that my physicians are part of that plan or the facilities are part of that plan. Unfortunately, a good friend of mine was diagnosed with colon cancer a few years ago, and she received surgery and then post-op care in the surgical clinic from the same institution, and now owes her insurance, or rather owes the clinics as part of that institution $20,000 because the hospital was part of the insurance plan, but not the clinic, which she had no sense of when signing up for the plan and was never told, as she saw that same surgeon at the hospital and then the clinic. Things like that can't happen. That data exists somewhere. Insurance companies are making decisions around what they do and don't cover. We have to get that out there for people when they're buying insurance. Second, they want cost information. And third, they want formulary information about the medications that are included on their plan, so they're not suddenly having to go on and off often very important medications that might have some pretty significant medical downsides if you're having to switch around if it's not covered by your insurance. For all of you in this room, how many of you had any of that information, much less all of it, when you purchased insurance recently? Haley, awesome. I want to know what your insurance plan is. But for most of us, that's just not possible. And obviously, government doesn't hold all of that information, but we have a lot of levers that we can pull that ensures that it's out there. CMS this fall released a request for public comment on requiring insurance companies to provide this information that are part of the marketplaces. I think we all really need to get behind efforts of that nature too.
Great, fantastic observations. So I'm going to switch gears again and talk about some work that was done on behalf of the California Healthcare Foundation. And over the years, Andy Krakow and I have been working together and kind of cataloging what some of the best practices in open data are and what some of the uses are, and have been enthusiastic supporters. And this project gave us a chance to kind of step back a little bit and step back from the enthusiasm, which is well justified, but to really ask whether open data was improving our health. And to look at, to really go to some of the state and local jurisdictions that are considered leaders in the open data space and find out whether they had documented any outcomes related to their open data programs, and if so, how some of those impacts were being evaluated. And 4 really compelling stories emerged where we thought that open data was really making a difference. The first, I can touch briefly on because Dr. Bhatt did a great job of talking about how innovative Chicago is, leveraging open data to address foodborne illness, as well as other environmental related health problems. But, foodborne illness is a huge problem. It causes a lot of illness and grief. And so I think that the one thing I'll add to what he said is that they not only built the predictive models so that they could target their inspector resources more effectively, but then they evaluated the standard sort of protocol that they used to use to deploy inspectors, which was probably somewhat crisis mode, I'm guessing, I don't know. But they compared the old protocol to the new protocol based on the predictive model, and they found that they could identify food handling practices that were either serious enough to close a restaurant down or critical enough to have to be addressed on the spot. So I think it was along the order of between 5 and 10% more of those critical violations that they were able to identify. So that was one important success story of open data. The second of our case studies, and the case studies I think can be just briefly shown on the slide here, involved the surveillance activities around childhood obesity. So I don't need to tell anybody in this room what an important health issue childhood obesity is. Contributes to a huge burden of health in our country for children as well as adults. And the surveillance activities are critical to understanding the patterns of childhood obesity and designing interventions to address them. And this surveillance is done in partnership, as in California, between all the schools collecting data and heights and weights. And in New York, they actually, by law, contract with the health department. They have to turn the data over to the health department to analyze and disseminate the findings. And so the health department they decided to apply kind of a classic surveillance evaluation approach and found that they were able to more effectively disseminate the surveillance findings using the open data portal versus traditional measures. And in fact, one important tenet of surveillance or criteria is that it be timely data. And they were able to cut their data, the amount of time it took to analyze and disseminate the findings, in half. So they went from 2 years to 1 year. And that can be a really critical time period, so keeping your data more accurate and more reflective of the current state of things. There were a number of other efficiencies that they realized from using the open data portal, and they cataloged some of these too. But one of the other impacts that they noticed was that the media coverage was vastly greater than it had been for their previous reports. And the media, not only did the volume of media coverage go up, but the visualizations and the kind of complexity of analyses and the local news reports really became much more powerful and relevant. And so they were able to see more impact from their data that way. The third case study, it goes in a completely other direction. It really talks about San Francisco's efforts to address pedestrian injuries and fatalities. Pedestrian injuries and fatalities in San Francisco are about 4 times higher than other areas of the country or of the U.S. as a whole. And so this has been a really important problem in San Francisco. And the health department first of all, they leveraged open data from the California Highway Patrol to map the street corridors where most of those injuries were happening. And it turns out that 6% of the street miles in the city of San Francisco were responsible for 60% of the fatal and serious pedestrian injuries. So that was the first, impact of the data. They were able to map those street corridors, take them out, talk to the police, talk to the community about what was going on. And then the second thing that they did was so this got it on the agenda of the city, but the second thing that they did was they leveraged their open data portal and open data sets to create something called Transbase. And it can get very technical, but essentially this was a data set that the transportation planners needed to actually make the physical improvements to the intersections and the streets to make them safer. And so by leveraging open data and creating this resource, they were able to get resources. At the time of the interview, it was 17 million had already been put into the street improvements. So they were able to get resources put in and actual changes made. So immediately the transportation department had the data that they needed to give people more time. I think in 800 intersections, they gave people more time to cross. They're improving the ramps, leading up to the crosswalks and things like that. So real changes that you can measure. They didn't use any fancy evaluation to do this. They just really cataloged what happened. So the fourth case study is yet in a different direction, but it involves the clinical, the quality of healthcare, and specifically the healthcare-acquired infections. And these are, vastly important. They're costly, they're dangerous. Approximately 1 in every 20 people that's hospitalized develops one of these infections. So they're a really important problem. And really the last study looks at the potential of open data to accelerate improvements in the area of healthcare acquired infections. The data has been, in most states, is publicly reportable. So it's mandated to be to be reported. And so I think that in addition to reimbursement policies at the federal level, have already started to make huge changes in this problem. But the case study really explores whether open data can further accelerate these changes in a positive direction. And I think, as Dan Kim was saying yesterday, we're really excited that the California Department of Public Health will be putting their healthcare-acquired infections up on the portal. New York has started doing that, and they haven't really evaluated, but they have been pleasantly surprised at how popular the data set has been. It's data that everyone can use. I mean, the health department isn't the only one to intervene in these in stopping these infections. We really need a whole host of folks to use the data to intervene. So I think I'll leave it there and move on to questions.
Tessie? All right, thank you. Thank you all for your great intros and overviews of your organizations and what you're doing. I think that what we really want to do is shift gears a little bit and talk more about what I know to be immediate problems or challenges for many of the individuals in this room. And the first thing that I'm sure they want to know, is around the envisioning process. We identified several barriers to really effectively moving open data forward, the initiative forward within agencies. But I think that the greater challenge, at least from what I hear, what I've seen, is around the strategy and around the business justification as to why they should do it. What are your thoughts, collectively or individually, around developing a strategy for open data and then building the business case for how you would justify that to the leadership within the agencies?
So, Chris, I think that's a really great point and question. I think that, one, it certainly starts for having the support and the cover to do the work. So for Chicago, innovation is a value that they've espoused, right? So I think a lot in this framework of challenge, choice, outcome. We're faced with challenges in our lives constantly. We make a choice in response to those challenges, and there's an outcome. And if we string those choices together, those choices illustrate the values that a person, an organization, a community espouse to, right? And so consistently, the choices have sent one message, that this is something we have to do. There's great opportunity in it. It'll make the impact in a way on people that we haven't seen before. And it starts with illustrating to the community, just like DataFest 1 did, and just like this is doing now, and other conversations across the country, of what's possible, and showing, sort of where we are versus what is possible, and showing that tension and inspiring hope against fear. And so I think that, as well, there's this process of change, and with change comes pain, comes loss, and how do you help people tolerate that pain and loss in the process? And so sort of really being intentional about thinking through that and identifying that, and then incorporating that into the strategy, which sort of the discussion yesterday. And then what is the low-hanging fruit, right? So we had issues, inspections being one of them, is an area that we felt like data, actionable data, could make a real impact. And then who are the partners within city government, external, outside of city government, but for this community, certainly within government, that were willing to be early adopters and partners in that. And then, we've worked with incubators across Chicago, launching, for example, a Healthy Chicago Innovation Challenge, which also gave our staff the opportunity to work towards putting data sets up that folks at the challenge could use. So using some of those anchors and illustrating what's possible, and them getting excited about the work that they're doing. And the other framework is identifying data, collecting data, sharing it with the public and our partners, and then leveraging that data to make policy, systems, and environmental change. Because that framework of change is sustainable, meaningful, and lasting. And the other is, which is an issue that alluded to in this conversation over the last few days, is how do we actually help people make use of the data? So sure, you can put something up on the platform and it can be out there, but that doesn't mean people know how to use it. So we've been very intentional about having conversations with community-based organizations and with residents of the city, who I think are really the future public health workforce of this country. I mean, the Twitter app with Foodborne Chicago is an example of that. There are a number of other examples. How do we empower and engage the residents of a city or a state or a county to be that public health workforce?
All right, I'll be brief. Two things. First thing is a little bit of a repeat. Start with a human problem, and not a human problem that we came up with, but a human problem that you developed in partnership with somebody in your community. That narrows the focus of the first project, and it's going to have, you'll be able to very clearly measure how successful your efforts to open up data towards solving that problem actually is, if it's focused around a specific problem, and you're not just dumping a giant data set on people. Two, our team mantra at Code for America and our close partners that we're working with, especially in San Francisco, in nonprofits like the Food Bank and at the Human Services Agency around improving CalFresh and the enrollment and the usability process, is JFDI, which is basically the Nike slogan with another word in it that I won't say out loud on stage. And I really mean that. I think sometimes we get caught up in a 5-year planning process around releasing a massive amount of data from all the different departments to solve a massive number of problems. Again, pick a few problems that you and your community deeply care about, get that data out there, start solving problems, and it's that momentum that's going to lead to greater usage of your open data portal and more data let out in the future.
I love it. JFDI. I'm going to come back to Chicago because I think initially, correct me if I'm wrong, but the restaurant inspection data across the country, coast to coast, restaurant inspection data is the #1 most popular public health data set. That has been true. That's my personal observation, that it's very popular. I think because it addresses a problem that everyone confronts, that everyone is concerned about. People want to know. People want that information. And initially when Chicago released the restaurant inspection data, it was in a very simplified form. And what were the inspection scores? And then eventually when they partnered with Allstate and Northwestern, kind of expanded, right, the data set to include more complex elements. But I think the important point of this rambling story is starting with something that's meaningful to people, and starting where you can start. So even if it's simple and building from there. Everyone I talked to of these 15 leaders across the country said, just the act of starting is really, really important. And then you iterate and you find out who your audiences are and who's interested and work from there.
Thanks, Cheryl. Just to add to what Cheryl said and provide some clarification. So the partners were Civic Consulting Alliance and Allstate. So this is an interesting lesson, right? That Allstate spends part of their time, their employees have to do pro bono work. And so we said, here's a problem that the city is grappling with, and they have the capacity and skills that a health department doesn't necessarily have. And so how do we work together during that time where you have to contribute pro bono sort of contributions to the community? Instead of being out in a community-based organization, they help the city address this problem. So I have no budget, really, and so we've had to find interesting use cases and partners to do this work. And we've been very lucky and grateful to those partners. The academic institutions the same. So Northwestern wasn't a partner in that. But the interesting was that the food inspection data didn't get redesigned. What happened is we used the data over the 10 years so prior to that point in time and ran it across a bunch of variables. And after running it across those variables, identified 13 variables that were most likely to predict critical violations, and then tested that in the field. So and all of that data was on the open data portal. So it's not new data that we created, not data that we shared, and it came across city agencies, which speaks to also something else that Chicago is doing is around the smart data platform. So having a data warehouse where city agencies are sharing their data, and then that data warehouse is a predictive analytics engine on it. And so you could, from housing, ask really interesting questions about data from other places and integrate it and do something with it. And so lead and food are examples of how that is feeding into this smart data platform. And all the work that we do is open source. So we want to share it, and we put it on GitHub, and really think that that's an important value again, and a choice in the face of the challenge of whether you close it or open it.
Along those same veins, Dr. Bhatt and Cheryl and Rebecca, we talked about, so you gave me some great examples, some great tips for how I would initiate this initiative within the agency. But what I want to hear more about is how do you measure success or impact of those initiatives? I know if someone were to come to me and say, I want to do this, first of all, I want to know how much it's going to cost, and secondly, I want to know how do we know if we're successful at doing that? Let's start with you, Cheryl. How do you measure impact or outcomes of these particular initiatives?
Well, I think any kind of evaluation is hard. I mean, I think understanding what kind of problem you're trying to solve is really critical. And I think, as Jay highlighted, the value of partnerships and leveraging the talents that you might not have internally, I think can be really critical. I think one of the benefits, whenever you're publishing data and getting information out there, you don't really know who's using it. You might have a few examples of how it's being used or generic examples, but I think one of the advantages that the data portal gives you is to actually be able to see who's using your data, or at least measure downloads. You might be able to see who's embedding it and who's linking to it on a regular basis. And so identifying those customers and really trying to understand how they're using it, what difference it's making, I think is a really great place to start. And those are available from fairly simple analytics that can be derived from the portal.
Sure. I'm going to answer this question in a slightly different way, not to be a politician about it. But I think, again, two things. I think the hard part of this is not always measuring impact. It's figuring out the problem that you're trying to solve, especially the most important problem that you're trying to solve, and really keeping yourself rigorous about ensuring the way you're measuring success is not based on tactics, but based on actual human outcomes. I think it is really important to evaluate how many people are picking up that data and putting it into tools and putting it into visualizations, but that doesn't matter if all the things that they're creating aren't solving problems for people, right? And I would say one thing that I often see this whole movement fall prey to is thinking about the tactics and not really seeing whether or not it's having the impacts that we hope open data will have writ large. So again, starting with a human problem, it's easier to figure out what you're measuring at the end of your initiative.
I would just echo those sentiments, but also add that I think it's important to figure out what the indicators are that you want to measure to suggest success, right? Success in different situations looks different. So some might say that failure is a measure of success, whether you've tried and reiterated over a period of time to get to then the success of impacting people's lives in a jurisdiction. Or it could be that it increased the capacity of your staff to be able to do the innovation work.
So, you know, I'm going to ask another question. I want to open it up to the audience for more questions. But I know, Dr. Bhatt, you mentioned predictive analytics as being a key, or essentially the future of this open data movement. You want to elaborate on that and what the possibilities are and what you envision?
So, you know, I will sort of build on what I've talked about before. The pillars for us are informatics, app development, and predictive analytics, and they sort of support each other and also leverage the foundation of open data, but then integrating that open data with other data. And as Rebecca alluded to earlier, thinking about, you know, what are the unlikely partners and unlikely data sources that might generate insight that then generates decisions that can have far-reaching impact. And so when you think about, you know, the relationships between building or block party permits, for example, and what do block party permits suggest about social cohesion in a community? So it's not an issue that you would think about, but in our work of amassing all this data to help us think about what is Healthy Chicago 2.0 with an equity framework is questions like that about housing and education and transportation and so forth. And I think predictive analytics will help us think about how we allocate resources, how to prevent sort of things before they become issues, and 3, how to show a return on investment, and then sort of change the way we work so that we can do more and do things differently.
I just want to add one more thing. I think that case studies highlighted the kinds of outcomes that people want to see at the community level. But I think people were afraid to say that, well, we saw that schools weren't pulling their physical activity and nutrition programs in districts after we put this data out, but they were hesitant to say that this was directly related to the open data program. And I think that's where you, like, structuring some evaluations can be really valuable. Because maybe you can focus on, you know, 1% of what those investments are, but I think those examples can be super powerful and applied, analogous to other situations too.
Perfect. Do we have any questions from the audience? I can continue, but I just want to see where we are. Andy? We have a mic coming to you.
Hey, so this is a question mostly for you, Rebecca, although others can feel free to chime in. I agree completely about, you know, we've talked about it, human-centered design and, you know, start with the human problem as a way, because I think if you do start there, you're more likely to find success with open data. But I suspect that that may be a difficult gap for government to make. You know, how has Code for America helped governments start with humans as the problem, you know, thinking about human-centered design? I'm wondering if you can talk a little bit about that, because making it concrete may help, I'm thinking, folks here see, I see what we can do.
Sure. So I would say the tactics employed are very, very simple. The hard part is sort of getting people out of their workflow of being in their offices and endless meetings with each other into interactions with their community, especially in a way that complies with all the laws around how people in government can receive that sort of direct feedback. I know certainly when I was at the federal level, it was really challenging to me how easy it was to interact with like vendors and other groups that could easily send someone to the table for all of our sort of working groups and other meetings to have their perspective represented, but like, you know, patients couldn't fly across the country and take 8 hours out of their day once a month to be part of the working group, right? So we were missing a whole, you know, contingency that was really, really important. So we did this in a couple ways. When we partnered directly with local governments, teaching how to do user-centered design and how to interact with communities is something that's a core part of our program. That is taught sort of through osmosis by focusing on a specific service that we're trying to improve through technology and data and really reaching out to that specific community. Again, the tactics employed fairly simple, just getting out of the office, inviting community leaders into the office to ask those sort of questions and create prioritizations around their needs. We also have a program called the Brigades Program. It's over 100 different organizations across the country, all volunteer organizations of civic hackers. Although they're much more than hackers, they're also people that are community leaders, patient advocates, hold other positions within their community that want to have sort of an organizing body that is there to work with their local government, both in building technology and making data useful, but also being a voice to represent the community around decision making.
Any other comments? Okay. Any other questions? Oh wow, we have a few. Okay, we'll start right here.
I was wondering if any of you work with the Joint Commission, hospital licensing people. I mean, they have the attention of a lot of health people. And I add additional questions that something to be of interest to you. Do you work with the Joint Commission?
Do you work with the Joint Commission? That's the question.
So for the Chicago Department of Public Health, the clinical delivery of services is minimal. It's not like a health system or a community health center network. So we work with them in conversation and thinking about ideas, but not as other jurisdictions or entities might work with them.
Hi, thank you. That was great hearing all of the different perspectives. I'm Elizabeth Bach with the Governor's Office of Planning and Research. The question is mainly for Dr. Bhatt, but I think everyone has touched on it a little bit. One of the issues is it's really fascinating to think about predictive analytics, but it's a very different approach from typical kind of analytical methods in public health. And I would love to hear some of the lessons that you've learned, if you could share that with the group, and where you see it going and how you were able to partner with private sector.
So thank you for the question. I agree. There is this tension about traditionally trained epidemiologists in a health department making sense of predictive analytics and data science, which is an emerging area. And part of what helps is if you can have a use case, evaluate it, and then illustrate what the impact is. And so we've noticed that as we've done that, there's been some further engagement across the agency. The other is sort of having the vision and support from the top to move some of this work forward. And the third is doing some of the learning sessions. So the Department of Innovation and Technology, who is leading the Smart Data Platform work and is a key partner in our predictive analytics work and really a strong engine in the city for that, is doing sort of design-oriented teaching sessions for staff at the department. And so we're exposing folks to the different way of thinking and having a lot of, this is also bringing sort of natural organizing principles to work of having one-on-one conversations with the staff and the folks in your community to sort of illustrate and help them work through that pain and loss that they have to make this stuff happen.
Good morning. Thank you for a very interesting discussion. I love the idea of open data and transparency and crowdsourcing research. I think it's a fascinating objective. However, there are people that go to school for 25, 30, 35 years to become researchers and to understand the methodology and to understand underlying processes that might be at stake. So I'm wondering, is there some responsibility with open data to also employ some support and, for example, someone they could contact to better understand things they might be finding? And I don't mean a simple list like which restaurant might have the biggest health concerns, but when you're looking at diabetes in a community and it's super high, that maybe that's because there are a lot of Hispanics in that community. So we need to come at a problem with some understanding of the problem, right?
I think I'm going to say something and then Cheryl really quickly. All of us on the panel seem to be vigorously nodding our heads. So I would say a resounding yes, absolutely. That comes back to this wanting to build that internal muscle to understand the nuances of the data and different ways that it can be used and things that should be considered when it's used. But I would also say a couple things related to that. I also know a large number of researchers that are using the open data for their own research now that never had access to it previously. A really close friend of mine who's a rheumatologist comes to mind, and she's elated by a great deal of the sort of quality and outcomes data that CMS has recently released, and is publishing some pretty divisive papers, candidly, in her field around what does and does not work in terms of interventions. I would also say that I think while both the things that I just said are very, very true, we also are in a situation right now where enough data is often out there that it's easy for people to come to the wrong conclusions, whereas we might be better off if we just went all of the way and released a larger amount of information. And I especially think that's true when it comes to questions of like quality indicators and assessments of physicians and that sort of thing. Like it's just enough to sort of be dangerous, but not enough to get the whole picture, and not enough voices like it sounds like yours at the table explaining the nuances of the situation.
Yeah, that's a great point. I'm glad you brought it up. And not to like double, because I would have said a couple of the same things, but everyone I talked to talked about the importance of really describing the data that you have. So bringing the researcher's knowledge to the information, documenting it, making that available. And they also talked about the importance of having you, the researcher, or whoever it is, the expert, at the table with the folks impacted by the problem, having a lot of different perspectives at the table when you're deciding what to do with something. So I think it actually elevates the researcher's role, not only in a technical way, but a participatory way.
I'm hearing a lot about open data. It's great, awesome. I applaud you guys. But one thing I've been listening to is regarding open data is we need the federal, state, county, municipal to embrace open platforms, because it's the platforms, the infrastructure of technology that creates the data samples that we all need. And we from government are not willing to embrace those platforms created by hackers, like the Los Angeles hackathon of 2 weeks ago, or other hack events across the US. And we shut them out. We're doing a disservice to the public, doing a disservice to the homeless vets and the advocates that are looking at the ground floor and embracing those hubs, because I'm involved with the hub of LA, the same organization you belong to. And I see a big swell of folks creating platforms and saying, you can't participate. If you do that, we're not going to get those data sets.
I mean, I think we all absolutely agree. Do you have a specific question you'd like us to reflect on? Okay.
I'm hearing that piece, and we're not talking about these open platforms that are available already. General.
So I would just go back to this sense of open source and open community, and I think that it's important that in this process, which is in this movement, which is new, to be open to what's coming, and then be critical and thinking through what you engage and what you don't. Smart Chicago, we were talking about communities yesterday. They're an important community in Chicago that's supporting this work, and they may engage in sort of the Tuesday night meetups that then generate some of these platforms, and then only some people participate, but then making that open and sharing the story really gets others to be part of that process. And so finding ways to involve and engage people through various venues is important.
All right, so we're getting the red light. I think if you have any other questions, feel free to follow up with the panelists or myself after this discussion. I'm sure we're more than happy to delve deeper into the topic. But as key lessons learned, I want you to walk away with a few things. When asked a question about what do you think are the keys to developing a successful vision and strategy for open data within your agency, Dr. Bhatt first started off with saying you need to identify low-hanging fruit. You need to identify a key change leader within the organization, engage and embrace the innovators community, essentially identifying specific data sets that would be of immediate value, and engage with the broader citizenry in order to ensure that that happens. Rebecca also said, start with the problem, and she repeated that statement. Start with a small sample data set and build momentum. That's key. And also find ways, and she mentioned ways of where we dove into a little bit more about the measurement piece. Cheryl reiterated several of the points, but again, she talked about identifying key data sets that particular user groups would be highly interested in, and she gave the example around the restaurant data. So, but furthermore, what Cheryl also identified was the kind of natural movement towards the social determinants of health and using some of these data mashups in order to understand problems a little bit better than we do today. So I advise you to follow up with this distinguished panel and find out more about how they've approached things and the way that they've addressed these barriers. Thank you all for your time.